Well, welcome everybody to today's Reverse Rett Bite-Size session. It's the first one of 2022 after the winter break that we've had. For those who don't know me, I'm Rachel Stevenson, and I'm the parent of two girls with Rett syndrome, neither of whom can go for a walk anymore. They're adults now, and I'm also the CEO of Reverse Rett. And so just a bit of general housekeeping. If everyone could put their camera on, if possible. Obviously there's moments for all of us where we might need to turn the camera off for a few minutes, but it is good if you can, just to see everyone's faces. Also, please can you keep your mic muted unless you're speaking, because it just helps with the sound quality. The session is being recorded, as you probably already noticed, and this is so that it can be shared more widely afterwards. So please bear that in mind. And feel free to pop any questions that you might have in the chat box at the bottom, or you can put your hand up, or you can ask at the end of the presentation. We are really grateful that we have qualified professionals here today to talk to us about physio. But please bear in mind that you should always talk to your child's own or your adult's own physios before trying any new exercises or activities. And with that, I'm going to hand over to Beth to introduce Sam and Zoe properly. So thank you.
Morning, everyone. It's great to have you all here and to be back after the winter break. I'm really happy to have Sam and Zoe with us today. I'm really grateful that they've given us their time. The reason that we've invited them, or the connection to Sam and Zoe, is that they have been doing some personal physiotherapy with my own daughter Hannah, who's just coming up to 15, and they've been working with her for over a year now, and have really had a positive impact on her movement and mobility, and also her confidence. And that's been especially useful following lockdown, where we obviously missed out on therapies and her mobility really deteriorated during that time. And the other way that I think is really helpful, and why we really wanted to bring this to a wider audience, is just guidance on how to be able to build things and embed things in your lives at home, which as a parent often feels a bit overwhelming and a bit arduous. But Sam and Zoe have really helped us to just find simple ways that we can help improve Hannah's mobility and keep her as mobile and as active as possible at home. So I'm really looking forward to them sharing their expertise with us all. I know they're going to give their own short intros as well, so I will hand over to them. Thank you, Sam and Zoe.
Thank you. I'm going to share our screen. It's nice to meet you all. Let's get this up. I think it's loading. Can everyone see that?
Yeah.
Perfect. Right, so myself and Sam are both sports rehabilitation therapists, so we're very much exercise-based therapists. So it's very similar to physio, but it just slightly differs. So I'm Zoe. I studied at St Mary's University and I graduated in 2018. I currently work within the NHS and within private clinics, and I've also done some sporting environment work as well. I've experience with working with a variety of individuals of all abilities.
Yeah, so I'm Sam, like Zoe, sports rehabilitation therapist, graduated same year, same university as Zoe. I've worked within private clinics and semi-professional and professional sporting environments. And I think the link between sports rehab and actually working with people with Rett syndrome, where we are more exercise based, I think it is a real, it's something that should be used quite a lot to help those suffering with it. I've also worked with a lot of patients with a variety of disabilities as well. So that's kind of my background.
So we're not experts in Rett syndrome. However, we can try and give you as much tips as possible of stuff that you can be doing at home, and also looking after yourselves as well. So as you guys all know already, Rett syndrome is a rare progressive neurodevelopment disorder. almost exclusively to females, and it affects 1 in every 10 to 15,000 females. Children typically show normal development until the age of about 6 to 18 months after birth. And then we start to get the regression of motor and communication skills, cognitive impairment, stereotypic hand movements, abnormal breathing, and gait abnormalities, so changes in their walking patterns. It's a multi-system disorder, so it primarily affects the nervous system, but it also impacts the child's growth, pubertal development, and then overall health. So we get comorbidities. So this involves stuff like scoliosis, low bone density, which increases the risk of fractures, epilepsy, gastrointestinal problems, sleep disturbances, and also unusual breathing patterns. So for us, the main things that we would really focus on is sort of like that musculoskeletal system. So looking at sort of like scoliosis and that bone density. And scoliosis is the most prevalent comorbidity that we'd be looking at, as it affects approximately 75% of individuals with Rett syndrome by the age of 15. So, into scoliosis a little bit more. There's loads of different orthopedic approaches that can be used to help manage scoliosis and to optimize gait and sort of skeletal alignment. It's not, you can't cure scoliosis through exercise, but we can definitely help to try and prevent it from worsening, and also help it if it's more of a muscular situation rather than the spine itself fusing. What we can get is sort of helping them in their positioning at home. So there's a few pictures on the screen here, and that's just sort of the positioning that you can utilize at home, which will go in a little bit more detail as well. And as well as scoliosis as well, what we also see a lot of is that kyphotic posture, and that's sort of that rounding of the upper bit of the spine, so sort of around the shoulders and upper part of the spine. And the bottom left picture that you can see, a nice way to try and promote a bit more extension, reduce that sort of kyphotic posture. So it's quite nice if they're watching TV to have them laying on their stomach, and what you can see here is they've done that on a sofa instead, to try and prevent sort of like having to go onto the floor. You could also do this on the bed as well, just to try and promote that as much as possible. There are sort of surgical interventions that you can do, and I would say always speak to your consultant for any of this, and they'll guide you with that anyway, because you'd have x-rays to kind of see. But we kind of would be looking at when surgery would be considered is when that sort of curvature exceeds sort of 45 degrees. But in the meantime, what we can do is a lot of management through exercise and physical therapy. So these pictures at the bottom have come from Dr. Mir Lowton, which you may have heard of. He done like a load of YouTube videos over lockdown, which were really good. And basically it's just people utilizing things that they've got at home. So you can see in the bottom right, they've just basically formed a nice sort of postural change, sort of cushioning, which they've used with like a bit of wood and then a load of foam to just try and make it a bit more comfortable, to help with that sort of changing that position from slouching off to one side and then lifting them up and trying to promote that better posture when sitting down.
So going on to bone density, and again, we're not absolute experts in the field, so again, we would always advise to talk to a specialist on this. But maintaining good bone density is absolutely key for managing a person with Rett syndrome. This is due to the high risk of fractures in the individuals with lower bone density. You may have heard of the terms osteopenia or osteoporosis. So osteopenia is a condition in which there is a lower than normal bone mass or bone mineral density. And osteoporosis is the health condition that weakens the bones, making them more fragile and more easily breakable and more easily to fracture. DEXA scans, so these are a type of low dose X-ray that tests and measures the calcium and other minerals in your bones. This helps to show the strength and the thickness, so your density and mass, to show how susceptible someone is to this, to having a fracture through the low bone density. The guidelines for Rett syndrome, vitamin D supplementation can be very useful. This is often prescribed through the GP, but if it's not something you've known about or not something that has been recommended, maybe bringing it up to ask, is this something my child should have? Because it might just make that little bit of a difference in improving their bone density. Increasing levels of physical activity, so weight-bearing tasks, as the ones you can see in the pictures here. Standing and walking, standing on a frame. If you don't have the standing frame, you could trial standing against a wall with assisted help, monitoring them and their stability. Doing this regularly will build up muscular strength and also will help improve that bone density. So the role of physical therapy. So our aim is to maximize and maintain function. So literature does suggest that preventative approaches undergoing functional therapy with a multidisciplinary team. So this may include a physical therapist, speech and language therapist, hydrotherapy, animal-assisted therapy like horse riding, and respiratory rehab. All of these should be adopted to a progressive nature of the condition. The goals are going to differ from person to person, as there is a large variability with individuals with Rett syndrome, but potential goals could include improving mobility and posture, reducing apraxia. So apraxia is the loss of ability to execute skilled movements and gestures. So you can do this through repetitive functional skills or functional movements and activities. Increasing cardiovascular fitness if able to, and stimulating the use of hands using splints or other fine motor activities. We want to enhance coordination and balance where possible as well. So practicing in various situations and environments. So using hard floors, carpets at home, school, all of these will help. Improving the body awareness through proprioception training. We've also found active music therapy. So I think in 2001, a case where 3 children took part who had Rett syndrome received 30 minutes of private active music therapy. It showed a degree of mental and physical development in all 3 of these, and improved purposive hand movements as well, and developed their language comprehension on top of that. There is no optimal time frame to begin physical therapy, but I think the general rule of thumb with people with Rett is the earlier the better. And also getting comfortable with a physical therapist and the exercise. So there can be an element of anxiousness that comes with Rett syndrome as well. So making sure a good rapport is built with the therapist, and also making sure that they're very comfortable in their surroundings as well. Just going on to our sessions with Hannah. So we currently, where we currently work, we don't have access to hoists or assisted equipment similar to the ones, well, not there, but well, we don't have access to the hoists. But our aims are to improve assisted weight bearing abilities, assisted transfers, assisted walkings, and a variety of walking distance depending on the day. Obviously, each day is going to be different as to what Hannah's been doing throughout that day already. So making sure we do stick to her ability of that day is essential. We also try to improve her seated posture and aiming to reduce the prevention of scoliosis. The equipment we use in our sessions are quite basic, but it includes a gym ball, With Hannah, we wedge a gym ball in between a wall, and we seat Hannah on this, and with our support, she then has to balance and fight that stability. And we've actually seen over the time we've been doing it, we are giving her less and less support, and actually there's less and less support from the wall as well. And it's been quite a good one for us to watch and see her progress in that way. We also, so it helps to build her core strength and working on the muscles around the pelvis with the sensory feedback for the balancing as well. Transitioning from a seated position on the gym ball also requires a lot of strength. So we're going to be building up her leg strength in this as well. Initially, it can trigger some anxiety. So you do want to try and start slowly and then build it up, and then also building that time that you're on the ball for. And I think that's a general rule of thumb with any exercise. If you want to try and make something more challenging, just increasing that time session by session, you're constantly improving them. We also use a pelvic tilt cushion to reduce the posterior tilt in the pelvis. This helps to keep a better overall posture. And again, like Zoe said, it helps reduce that kyphotic sitting. And it can be a great tool to use at home. So I would recommend that as an easy tool to introduce at home. Sitting on the bench with no back support helps to get those back muscles working in that stability element. Just a nice, easy way to challenge them and make sure they are working while they're sitting. We sit beside her, we help talk to her, which helps with that active rotation of the spine as well. It also helps to build up the repetition of these transfers and continue to prompt Hannah to position herself properly in the chair. We've also found that using prompting words and sensory feedback really helps. So when we first saw Hannah, we did liaise with her previous physio for language prompts. And so one of the examples was standing nice and tall. It does help promote Hannah to make sure she does bring that back up nice and straight to have that better posture. And we've also found that using like a sensory feedback to touch. So we touch Hannah's upper back, obviously to prompt that back to come up, but also touching her leg that she usually initially steps forward with. Touching that, we found, does help to initiate that first step to get her going, because normally that first step is the hardest to get going, and once she's got that rhythm, it's much more comfortable for her. And obviously, as we're back in the dance studio, there's a lot of background music, so that does help at times. So there's a bit of a distraction here, a bit of a distraction there, so it does, you've got to try and get her to keep focused, which is good.
So going on to things that you can do at home. So the gym ball, like what Sam was saying, we have found has been really beneficial. In the previous picture on the other page, you can see that the individual here is not propped up against a wall. And for some people, depending on sort of the age and the ability of your child or the person that you're caring for, that can be fine. But if they are needing a little bit more support, and also for yourself as well, to have that support with just making sure that the transfer goes smoothly, you can just sort of like wedge the ball into a corner. It works really, really well in just getting that stability, like what Sam was saying. A really key part for people with Rett syndrome is making sure that we keep feet in a good position. So this can sometimes be done through orthosis, so like a foot support around the shoe. Some people do have surgery depending on what is done, but a lot of physical sort of therapy around the feet is important as well. Combining both of those allows to prevent from muscular contractures. So basically those muscles get really tight and really stiff and rigid. It reduces joint stiffness, and it also regains that ability to transfer sort of independently or semi-independently. It allows individuals to walk better, even after a long period of immobility as well, which we've seen in loads of research. And in 2005, when we were talking about sort of scoliosis, There's been a case report that showed that patients who underwent intensive therapeutic exercise carried out with adapted equipment, so like a cushion, a seat, a chair, or a standing frame, kind of like what we've seen in previous slides, and hydrotherapy, the results seem to indicate that this intervention might be really effective in treating people with Rett syndrome. Not everyone has access to hydrotherapy, however, you can utilise that sort of sitting and standing position at home as much as possible. Like we saw previously, utilising sort of that foam padding that you can get, cushions, sort of wedging that leaning side arm up. So we're reducing that lean, getting them nice and tall to improve their posture and also help reduce that sort of tension in the muscles as well. It works really nicely, so after a really busy day, say if they were at school, for example, or just if you've had a really busy day and now you're just relaxing in the evening, making sure that they're in a comfortable position, but also we can still promote that physical therapy works really nicely. Some individuals find that soft tissue massage can work really well as well, and that can also relieve sort of that discomfort from that tightness in the tissues. Again, always just speak to the person that you're working with for your physical therapy, and they can suggest whether they could do it or whether you could do it at home, and they can give you some tips on that. Regular standing with or without a standing frame to improve balance and maintain bone density, and stretching the muscles is really important. As much as you can, obviously it varies so much, sort of the how mobile your child is, or the individual with Rett syndrome is as they spend a lot of time in a seated position, not only does it affect the bone density, as Sam has previously described, but also those muscles become a lot weaker and they can become really tight. Encouraging those sort of regular standing positions to help alleviate some of that discomfort from that muscular tightness, also increase in strength. And this also helps to improve those transfers as well, because they're used to having to get up out of their chairs for that standing, building up that strength whilst weight bearing. Facilitating sort of that transitional movement in a motivational setting. So like we've previously spoke about, it varies from day to day depending on how they're feeling, and also some days, like everyone, you don't want to have to do that amount of exercise sometimes. So trying to make it more of a motivational setting, sort of having to get out of bed, or going to sit to stand, or if they're having to move to a different chair to be able to have dinner, helps with just getting that promotion and motivation for having to do those transitional movements. Exercises to stretch the muscles, and there's a lot of focus on sort of lower back muscles, hamstrings, adductors, sort of like the groin muscles and the quadriceps as well. Due to sort of prolonged sitting and prolonged lying, these muscles can get really, really tight and really uncomfortable, which then changes sort of that pelvic positioning. So if we're then going up into standing and that pelvic positioning is more of like a tucked under, we're then getting to more of that bending over. So if we can loosen off some of those through some stretches, which I'll go through on the next slide, it improves sort of that function day to day. Finger feeding and sort of using therapy putty is really good for getting those sort of fine motor skills. Due to sort of just the nature of Rett syndrome, those hand movements become quite limited, and we can also sort of get those tightness of the muscles around. So using things like finger feeding works really nicely, and sort of that basically like silly putty or slime is really good as well. Quite a lot of people use sort of like try and promote them helping with sort of cooking if possible, so sort of like that mixing, and also you can obviously assist with them as well, just to try and promote a little bit of that. It can be quite difficult at times because they may not want to do it as much because it can be quite uncomfortable, so just starting off quite slowly and just making it as enjoyable as possible. Aiding decision making, so you can see in that bottom right hand corner picture is a good example of this. So trying to get that sort of cognitive ability and also trying to get them to initiate sort of pointing. as like, for example, trying to choose what book they want you to read for them, or maybe sort of if you're going to like have a snack, sort of like whether they're going to have like an apple or banana, and see if they can try and help with their decision making, works really well. Part as well that's not on here at the moment, but it's kind of muscle tension. Calming shoulder tension is really important. So from that sort of seated position as well, and also just the general tension that people with Rett syndrome get, it's quite nice to use like warm wheat bags that you can put in the microwave to just ease through here, and like a hot water bottle, for example. But quite commonly people use like wrist weights, or weights so that you can kind of put over the shoulders to help just sort of take away that elevation from the shoulders. Quite a few people use it when they're trying to get their child to do some regular walking. Having weights makes it a bit harder depending on if they're able to, but having weights around their wrist helps them to sort of take away that elevation from the shoulders and calm that down as well, which works really nicely. So we briefly touched on it in the previous slide, but sort of stretches you can do. So it doesn't mean that you have to do them on the floor. If floor transfers isn't something that you're doing, I would recommend doing them in bed. And to be honest, it's like most things, it's easier. You could do them in the morning, and you can also do them in the evening. The main areas that we would want to work on here are the ones that are really getting affected when we're sitting down. So your hamstrings, your quadriceps, and your lower back muscles. And as you can see here, so that first picture on the top left-hand corner, when they're laying on their front, you bring their heel towards their bum, and then that helps to stretch out through the quadricep. The one to the top right is stretching out that hamstring. So you rest their leg on your shoulder, and you just kind of take them through that stretch nice and gently. And I'd say for all of these, sort of holding for about 10 to 20 seconds, depending on how comfortable they are with the stretch. So just try and let them relax into it, and then release off that stretch, and try and repeat that sort of like 2 to 4 times, depending again on how comfortable they are. If they cannot lay on their front, then try laying them on their back, and you sort of prop them up with some pillows behind them as well. And then you take their leg out to the side and behind, and that stretches out their quadricep as well, so sort of round there. This one works really nicely as well, because we get a little bit more of that higher hip tightness release as well, which we're getting a lot of when we're seated down. So when we're stretching out in this way, it can work really nicely. Lower back stretches, we're looking at that bottom right-hand corner one. So you have the individual on their back, you bend their knees so they're resting their feet on the bed, and then you just passively move their knees together side to side. And again, similar, we're holding it for sort of 10 to 20 seconds. And remember, moving limbs is really difficult, and they're really, really heavy. So it can be really tough. So take your time, get used to the movement as well, but also really focus on your own posture. Otherwise it can be quite tiring for your back as well, which we'll go into a little bit more detail of as well in a bit. It can be quite uncomfortable at the best of times. So trying to do it whilst they're distracted. So maybe watching some TV, or watching like an iPad or something, or listening to some music. So it's more of a nice, relaxing, therapeutic approach, rather than having to really force into a stretch. Hip subluxations and dislocations are a really big risk for people with Rett syndrome. So when we're in that seated position for a long period of time, it can really, weaken around the hip, but also we can get a bit of a glide of that humerus in that socket. So if you think we're sitting like this, I'm not sure if you can see me in the camera, but because of that seated position, we can get a glide backwards, and that can cause that sort of subluxation or dislocation. So we really want to try and make sure that we stay nice and strong around those gluteal muscles to prevent that. So it basically helps hold it in place, so it's nice and stable. Maintain adductor length. So adductors can get really, really tight where we're in that seated position. So they're sort of your groin muscles, so they're on the inside of the thigh. The two pictures at the top, you can see some different ways. So depending on how old the individual is with Rett syndrome and how mobile they are, if they're quite young, the first one works quite nicely because you can position them in that sort of frog stretch. So frog legs out to the side. Stretching out that groin can work really nicely. And like one of the earlier pictures for that kyphosis stretch, where you're laying down and you've got a few cushions underneath your chest, you can affect both then as well quite nicely. And you can do that while just relaxing, watching some TV. If an individual cannot get onto the floor, then it's fine. You can basically use the second picture. You can use like these blocks to basically stop too much of that adduction and so that rotation of that hip to reduce those risks of fracture, subluxations and dislocations. Doesn't mean you have to buy one of these. You could use loads of pillows to basically get them from a position where their legs are quite close together, and then you're stretching them, so you're turning them out to stretch out through there and just try and maintain some different postures as well.
So this is a bit about people caring for people with Rett syndrome and your posture, especially in transfers. So if you haven't got the use of hoists or slings, which I don't imagine are the most common things to get hold of, but if you do have them, obviously make the most of them where possible. But you must ensure that your body position is right, because it's absolutely key to help prevent injuries. Protecting yourself in transfers is very important, and it's not only to safely transfer, but also to help prevent injury for yourself. So a couple tips: having a strong, stable starting position will obviously help make that lift much easier, and obviously again safer as well. Trying not to overreach yourself, so keeping everything close to the body. And not like bringing your arms out too much, because obviously further away from your center of mass just makes that lift much harder, and again increases your risk of injury. And trying to create like natural levers on the floor, so positioning legs so it is easier for you to shift if you are doing floor transfers. Preventing injury for yourself. So it's very easy to neglect yourself, but this can lead to your injury risk increasing. So being smart with your transfer, like we previously spoke about, keeping things close to the body, having a good, strong starting position, making sure that back is nice and straight is key. Working on your own strength, I think, is very important. So it's very important to do exercises for yourself to improve your own muscular strength and tolerance, especially as the child grows. It is going to become harder. So making sure you are able to deal with that is very important. I would say you can speak to your therapist about this for some injury prevention exercises for yourself. I'm sure they'd be only too happy to help you with this, but you should also make sure these exercises are within your limits. You don't want to do anything too advanced too soon, but at the same time you don't want to start with exercises that are actually, you're far beyond that, because you're not really getting the benefit out of it. I think, have we got some exercises on that? Yeah, so I will show you a couple of the exercises on this slide.
So when we're talking about sort of exercises for yourself to be doing and just looking after yourself, I would recommend sort of being active, so doing like regular walking or going for runs, or whatever you find works nice for you, but also trying to condition yourself. So if you think you're doing a very manual job, so you need to be conditioned to make sure that we're not getting injured when you're doing your lifting, and so on. So when we're looking at whereabouts in the body we want to condition, one is your legs, but your main areas that are commonly injured are shoulders and around that back area. So the first two that we're looking at on that left-hand side where those pictures are is your shoulder row, which works quite nicely. So you keep your elbows tucked in using like a TheraBand, so like a stretchy resistant band, tie it around either a door handle or basically something that's not going to move, like a table leg. Pulling it in so you're squeezing shoulder blades together helps you with that sort of transitioning of your child or the person you're caring for. As you're lifting them up, you've got that strength around the upper body. Those sort of pull aparts, so you're going all the way out with that TheraBand. Again, working all around that shoulder blade and upper body, so you're getting that strength to be able to help with that pulling situation with those transfers. And lower back is a really, really key area for anyone who's either caring for someone or just doing a manual job in general. We need that sort of stable lower back and nice strong core. So there's one that's called a dead bug, which is the top right hand corner one. And basically you're laying on your back, you've got your both arms in the air, and you've got your legs in the air as well in sort of that bent knee position. You're going to extend, you'll say your right arm, and you're going to take it behind your back. And then you're also going to extend your opposite leg as you go out. And basically what you want to do is really suck in that core, squeezing belly button in, getting that lower back control working nicely, so it's nice and strong for when you do then go into your lifting. So we've got final one, which is your bridge. And this can also be done in your bed as well, which works quite nicely. Or you can do it on the floor, whatever suits you. You're laying on your back, you've got your knees bent, sort of like a 45-degree angle. You want to make sure that your whole back is in contact before you lift up. So lower back should be touching the bed. You can kind of put your hand underneath your back, which works quite nicely to make sure that it's not arching. And then you lift your bum up and you come down. So this is basically replicating a squatting motion. So sort of that final end stage of like that squatting motion as you come back up to standing. This works really, really well in building up that strength around our glutes, which is key for that lifting. And I would highly recommend it. Obviously, these are very generic. We don't know you guys. It would kind of be a situation where you'd need to speak to someone specifically about some goals going forward or what would work best for you. But if you are going to try and do something, these work really nicely in marrying up with what you're doing day to day, and making it sort of relatable to what your goals are. Looking after yourself is not only physical, so finding ways to relieve stress is really, really important. What you're doing as caregivers is it can be quite emotionally draining. And there can be some really stressful times. So finding ways to relieve stress. So this can be done sort of like talking to a trusted family member or a friend, taking some time for something that you personally enjoy doing and just trying to recharge your battery. Otherwise, it's really easy to emotionally burn out. And if you're looking after someone, you have to have a bit of time to look after yourself to be able to give that energy to other people. So it's really, really key. Arrange for outside help. If you care for your child at home, seek help for outside caregivers who can come and give you a break from time to time, or may consider sort of residential care at some point, depending on sort of what your situation is. And as your child gets older, it can be a lot more taxing and they need a lot more care. So it's very dependent on sort of what your situation is, but it can be really tough. So optimizing your care system around you is key. Connecting with others, so getting to know other families like you guys are doing is really important, and it really helps sort of just share advice as well and makes you know that you guys aren't alone, and it's really important. So sort of looking for those online supports like you guys have is key. So yeah, thanks for listening. I hope that's helped. I'm sure you guys are probably doing a fair amount of this already, but we are open to having some questions as well. So feel free to ask them.
I would just like to say thank you very much to you, Zoe and Sam, both of you, because I feel like this session hasn't just been informational, it's really been full of lots of practical tips of things that people can actually implement at home themselves. And I really appreciate the value that you've put on the work, and you did call it work, that carers, all of us are doing. that you've acknowledged what we physically bringing to the, to the physical and emotional wellness of our children. It's not, it's a proper physical undertaking. Before the session started, we were just talking about having COVID, and I was thinking about when my daughter had COVID and I had PPE on and I was trying to do everything that she needs. And it's such a physical job. Even just the care is a physical job, never mind trying to do bits of physio as well. So I appreciate you acknowledging that. And it does have, as you've pointed out, a wear on people that I really appreciate, having had my daughter at about 20 and now I'm 46, and I can feel everything that I ever did wrong, but I also really embrace and remember the physios and therapists that helped me to make sure that I was moving correctly as well, and how to look after myself. So the other thing I wanted to point out is I think it's brilliant that you've talked about doing these intrinsically motivating exercises, so that we're not kind of saying to people, find a time to do this, that and the other, but also, generalizing things so that it's more of a part of your everyday life. Anyway, those are just my comments. I also have a few questions, but I think we should just fling it open to everybody else. Is there any questions in the chat, Beth?
There aren't any questions in the chat, but I don't know if there are any questions that anyone has, or if anyone wants to put their hand up, or either physically or on the screen, or just unmute yourself and go ahead. I've got some as well, but I'd like to throw it out to others first. It's very quiet. I was going to say at the beginning, if Sam and Zoe are happy for me to do this, I'd like to share the slides with everyone who's attended afterwards, so you've got some copies of those really helpful diagrams and exercises to remind yourselves. I'm sure there were some wry smiles as you went through the stuff for carers that were like, yeah, we know we should be doing that. And just,
I just want to say that those TheraBands, I met one of those a few years ago at the osteopaths, because I'd screwed my back up, and actually it was not just my back, it was my arm. And so basically my arm, one shoulder comes out the socket, and it happens to be the one that my daughter did standing transfers, like most of the pressure was on that. I wish I'd done that before I got to the point of needing an osteopath, because if I had, I wouldn't have this problem now. Probably I could have strengthened it then. And it just felt like it wasn't important enough for me to be doing stuff for myself. But the truth is that there's two people in that kind of relationship of supporting someone physically, and in order to do a good job for that other person, you need to physically be strong yourself. I just wish I'd known that before. One thing I was going to ask though is, when you had the picture where the person had a piece of wood to the side of them and they were kind of leaning on it like this, I don't know if I just didn't catch it, but was that the side that the kind of scoliosis is leaning towards?
Yeah, so if you have, say someone's got scoliosis and they're leaning this way, that's their sort of like natural positioning. If you get their arm and you get sort of like, and people in those videos, and I'll put the references that we've used, and I'll put on the sort of YouTube videos that we sort of saw that from. Basically, you have that sort of wooden, or with like some cushioning and stuff, or even just pillows, just loads and loads of pillows, and lift them up that way. It basically forces into that different position. You can get, and some people kind of make makeshift ones for for the chair as well. So having that sort of positioning where we're getting that sort of like shoulder lift and sort of different sort of thoracic mid-back positioning helps with just sort of getting that.
Well, one of the issues I have, if you don't mind me elaborating a little bit, is with my daughter. She's always been all right with the scoliosis, so she's got a kind of 30-degree, but it never really progressed. She's 26 now. But she's got really good upper body mobility, but she can't walk anymore. And so when you're always in a kind of balancing act, okay, how much freedom to give her so that she can keep using her upper body, but then supporting her at the same time. And so intermittently kind of putting cushions there and things like that is really good. But one thing we've done in the past is kind of put things of interest to the other side of her, like her videos that she likes to watch, so that she's got to kind of lean the other way a bit, which
yeah, so that works really well. And that's kind of like similar to what we do with Hannah in our sessions, is when we're sitting on that bench, which doesn't have the back, we'll sit beside and talk. So she does have to kind of turn and lean. And naturally, and everyone does it when they're tired as well, we're all guilty of it. It's like you put your arm out to lean if you're not having something that you can lean back on. So we try and prompt her to not have that there, and we try and get to just have a conversation. And definitely like watching TV or like food to the side definitely helps with that.
Yeah, it's just a natural movement or a natural way at home to encourage those movements that are really simple things you can just implement like that. That will make a difference, especially if you're compounding with a little bit. It does make a big difference at the end.
Like you were saying, Rachel, that your daughter has a good amount of upper body strength. A nice way to try and do more like lower leg, if she's able to do sort of like assisted transfers, she may not be able to do as much walking, but if she is able to do some assisted transfers, she will naturally probably want to push through her arms as she's trying to get up, depending if that is her situation. But just doing regular sort of like going from a sitting position to a standing, giving her assistance with supporting her arms, but not letting her push too much through, and then slowly lowering back down, helps to just build up that strength in the lower body. But again, it can vary.
That makes sense. So we got a couple of questions about the tilted cushion, and
Yes.
Before I ask the questions that are in the chat, can I just ask a question? When we were looking at the picture of the person on the tilted cushion, it was from the side, and I couldn't tell if they were sat cross-legged or if they were like kneeling on it, or what?
Okay, yes. So the tilted cushion is basically, it's like a wedge. It's a shame we should have grabbed it, but we haven't got it on us today. It's literally just like a wedge, and I can put a link and a clearer picture on the references on the PowerPoint when we share it. But basically, if you think of like a wedge of cheese, where it's like a slant, and basically you get them so they're like a smaller bit is sort of facing towards them as they're sitting down. So they're sitting with their legs off like that. So you can put it on a sofa. It doesn't have to be on the floor. You can put it in on their chair as well. They just with straight legs, I would say, not with crossed legs. Apologies, that probably wasn't the best picture. But I
don't understand how does that help then?
So if you move the go for that. So
Do you want me to tilt there?
yeah. Let's see if you can see. I'm not sure if you can see fully. So if I'm sitting, I'm really short, so I can't actually touch the floor. So if I'm sitting on the chair, and naturally I've got more of a tucked under position, which is common, naturally I'll sit more slumped in my upper back, so that kyphosis increases. If I then have a pillow that then wedges me, so the upper bit, so that sort of like wedge of like cheese bit is at the back, it pushes me more that way and forces me to sit more upright, which we noticed a bigger difference when Hannah then was sitting down. Naturally, she went from here to there quite quickly.
Or we could all use a tilted cushion, I reckon.
Oh, exactly. If you've been sitting all day at the desk, everyone's guilty of it. We're just all like tapping away, or if you're on your phone and you're watching some TV, it's just quite nice. It's a really good way to just tilt forward.
So you can get the tilted cushions. I mean, Hannah has one in her wheelchair, which wasn't the standard one that came with it, but then the physio at school said we need a tilted in here, so that even in her chair, in her wheelchair, she is supposedly sitting a little bit straighter during the day. I mean, I do see a difference from when she didn't have that, definitely.
It just works really well on just getting that positioning a bit more. And it's just, and also it stops sort of like hip flexors, so right at the top, knee, hips, those muscles there don't get as tight either, which helps them when you're going into a standing position. You're easier to stand up more upright. We've got a question which I think is a direct message to us from Ellen, which is what is prone sitting. Apologies if it said sitting, it may have been standing. Sorry, not standing, lying. Prone lying is laying on your front. So when people talk about being prone, you're laying on your front, on your belly. If you're supine, then you're laying on your back. So you might see or hear that term be sort of thrown around. But yeah, so when we were talking about being prone was when we saw that cushion underneath someone's chest. And that helped with sort of that kyphosis. And then there was another thing as well, I think, with the sort of the stretch for the front of the thigh as well in bed.
Ellen's also asked if there is a tilted cushion that you recommend. I don't know if
we can the one we use with Hannah, we're more than happy to try and send the link for that in. I'm sure we can find that somewhere, and that's worked great for us. So
because the one that Hannah uses in clinic is different to the one that Hannah uses on her chair. So the one Hannah uses on her chair is more like a sofa cushion, like it's quite nice and it's firm, which works really nice for like all day. And then the one that we use in clinic is it's similar to like a Swiss ball, like exercise ball kind of style, where it's full of air. So as it gets used, sometimes there's a little sort of like less air in it, which kind of makes you have to work a bit more as well on that stability. So yeah, we can send both over.
Yeah,
that would be great. Thank you. I had a question about if someone's child or adult has had scoliosis surgery already, how would that then impact the exercises or activities that are available to them? I mean, I know you can't give precise specific recommendations, but so some of the activities and exercises that were diagrammed and that you spoke about, would they then need to be changed if someone's already had surgery?
The sort of like the kyphosis one would probably be the biggest one.
Yeah.
Sort of like laying on their front, depending on what surgery they've had. Quite commonly you have like the rods basically inserted either side of the spine, which would limit the sort of range of motion that you'd be able to get to a degree. So
that I think would definitely be a question to talk about with your consultant, and asking about what exercise, like listing the exercises we currently do. Are there going to be any limitations there? That's not to say that there's exercises you won't be able to do, but if that is a case and you have they have had to have surgery, you will need to take another look at what they are doing for exercise.
It kind of depends exactly how many, sort of like how much has been surgically done as well. But those sort of like seated positions where we're encouraging more of a straighter spine anyway, I would still recommend doing, just because that will help with muscular tightness as well.
Yeah. Jenny's put in the chat, can the cushions be used in chairs, or do they have to be certain ones, e.g. size and fitting?
You should be able to, most of them should be able to fit into the chair.
I think the one we use with Hannah, I think would be able to fit in her chair. So I don't see a problem with that. You should be able to, but I'm not 100%.
They normally have sort of like the measurements in the description as well. So just double check, just measure the chair width and like the seat bit, and then just make sure that it would fit. But yeah, there's sort of like an average size sort of seat position. Then it's normally just like a bit of a square, so it should be fine to sit in with the chair.
I have another question, if that's okay.
Yep.
Well, that is, I know there was a part where you were talking about putting weights on someone's arms, and I thought it was really interesting because I've not really come across that before, and I've been to, done a lot of therapy over the years with Amber, but I was wondering if you'd mentioned, I don't know if I didn't catch it, like what kind of weight that would be. So like, how much would it weigh?
I would say
little.
start off really, really light. So it was something we came across recently, and it was by that, I can't remember what his name is, Moten, the guy who done the load of the YouTube videos, and it was something that I came across on one of those that one of the mums was using, where it would just be like, you like ankle weights basically, sort of like 1 kg or something like that.
I mean, I just can't believe that I haven't seen that before, because it just makes so much sense for Amber. She's had splints and stuff, but she's managed to break them.
Yeah.
Like the Houdini of splints. But if you hold her right, because she's left hand dominant, if you hold her right hand, she can sort of do stuff with the other one. And so it makes sense that if you just had something, you know, just to keep it settled for a bit, it might just calm her down entirely, actually.
Yeah.
Yeah, you could definitely give that a go. It'd be actually very interesting to see if that did work. I'd be quite interested to hear that.
And also a lot of the emphasis always for Rett syndrome is on legs and back and different things like that. But I always get really like tight shoulders and neck, and I spend all my time stretching. So like whenever I've got the chance with her, I just will like lift her arms up and give them a bit of a spin around. But I feel like, because, you know, because they're like this a lot of the time, it must be so tight there.
Yeah, and so you can do like simple neck stretches. So just like trying to lower this one side down and then just bringing that over to the side might just make all the difference in trying to relieve tension there. I mean, we see loads of the general public coming into us for tension in this area. And like you said, people with Rett's, they do hold that higher position. So it is going to be tighter. And if you think about how comfortable it is for you, if you've got that there, they're also probably going to have that. So stretching out there is going to help. So I definitely recommend that.
So you're saying that, you know, you could even just give her a slight tilt?
Yeah, a light assisted stretch there.
Just super, super light.
Yeah.
Because they may fight against it initially.
Yeah.
But even if you were to do like a sort of decompression,
you can
and then say, for example, you had like an iPad or some sort of distraction over to the other side, and then naturally they'll be more inclined to look that way, and your stretching through there can work quite nicely. Like hot water bottles, those wheat bags that you can kind of put over your shoulders are really nice. And just like the anxiety can be quite high in individuals with Rett's at times. So just naturally we're going to get a little bit more of that tension in the shoulders, and as we all know, it can give you neck ache, it can give you headaches, it can interrupt your sleep even more. So just trying to make it as much as comfortable as possible.
I also think though, all around there's quite a bit of, to me it feels like there's quite a bit of resistance when Amber's stretching, and she's had to do it her whole life. But I mean, part of that is just to think, because they're so, you know, often quite highly strung, and their whole like physical self is kind of like this. So then when I'm going to like put her feet, you know, try and get her feet back into a better position, there's a lot going against. And one of the problems is when trying to encourage carers to do stretches is trying to get people confident with the fact that you do have to just, you know,
get them into
help her, you know, rather than feeling like, oh, she's pushing against, because there's not a kind of a way of going calm down and relax into it.
Yeah, exactly. And I think that's the thing, there's always sort of you're always worried that you're gonna do harm, because you're like, well, they're not enjoying it, it's really stressful, it can be it's overwhelming, it's very overwhelming, and it can be really hard. So similar to sort of like the stretches in bed, just trying to do something that's calming in the background and the distraction, so the music works really, really nicely whilst that's all going on, to just try and make it a calming and relaxing experience as much as possible. And yeah, just doing what you can and what you find works well for the person you're caring for. And yeah, trying to fit it in your day. And like I said, we say it's just general public with rehab. Rehab is really boring and really taxing. at the best of times. And when you've got to do that every day, you don't want to feel like you've got to do an hour of physical therapy every evening when you've come home from a really busy day. So just trying to get into a routine works really nicely.
I think that's been just really, really helpful, and the nods and the smiles I'm seeing, like, yep, there's lots of stuff that I think we all know that we can integrate. I was just going to throw in one thing, just because I actually had 2 inquiries about this after our Facebook post promoting today's session, which was a little bit about Hannah, and I think I'd mentioned in there that we actually are able to use Hannah's personal budget to help pay for sessions with Sam and Zoe. And I got a couple of people actually writing to me and saying, oh, we've been told we're not allowed to use our personal budget for physio or any therapies outside school. We were told the same thing. And I don't know whether this works in all geographical areas of the country, but basically we were told we can't use personal budgets to pay for physiotherapy, but if you call them personal trainers, you can use it. So Sam and Zoe are Hannah's personal trainers, and that means we're allowed to use the personal budget. If I call them her physios, we're not allowed to use it. So language is apparently quite important when it comes to what you're asking for. I don't know if that would help anyone, but just in case, I thought, since I've had 2 inquiries, maybe it does. Whilst all this is brilliant for integrating into our daily routines, I know that my daughter, and I know that some of your daughters would be the same, much more responsive to other people, especially lovely, smiley Sam and Zoe type people, than to me. So Hannah will do things in her sessions with these guys that she will not dream of allowing us to do. So if you do have access to maybe introducing that on top of school physio or wherever your child is accessing physio, then it's maybe worth seeing if it's a possibility. But I'm aware that we're slightly over time. Thank you, Sam and Zoe, so much. I will send everybody out the slides, and I think Zoe's going to build in those YouTube links and links to things, equipment that you might want to have a look at. So all that will come to you soon, and that will also have the link for booking our next session, which is actually a Rett Registry UK workshop. So if your child is registered on the Rett Registry already and you would like some kind of guidance on how to get the best out of the registry and how to use it to its max potential, that will be a useful workshop. And if your child isn't on the Rett Registry already, please sign them up. I will put the link into the email as well. So thank you everyone for joining. It's been great to have you back, and thank you again, Sam and Zoe, for a very, very helpful session.
Yeah, thank you so much. Lovely to meet you.
Thank you, everybody.
Bye,
take care.
Bye, everyone.
Bye.